Welcome to MyKneeReplacementRecovery.com. Today I'm going to talk to you about the importance of flexion and extension. Range of motion is another word for that. My home therapist who came to my house 3 days after surgery emphasized the importance of improving my flexion and extension right from the get-go. She gave me several exercises to do that. Unfortunately, they are probably the most uncomfortable and painful exercises, but looking back, they were the most beneficial ones. I'm glad that I stuck with them, worked through the pain, and I increased my flexion and my extension thanks to doing those exercises. Flexion, if you look at my angle of my knee here, that's about 90 degrees, and any further back is going towards 120, 130. If I extend my knee, which I'm able to do now, to 180 degrees, that's the maximum. I didn't have as much trouble with the extension as I did with the flexion, and I really had to work hard on that. Not everybody is going to get the same amount of flexion or extension after their knee surgery. A lot of it depends on your health going into the surgery, your weight, the flexion and extension that you had before. My knee had begun to bow and I'd had a lot of trouble with it, and I didn't have that great a flexion to begin with going into the surgery. The first exercise that I'm going to show you takes place sitting in a very stable chair, preferably with arms that you can hold on to. It's best done on a floor that's a tile surface or a wood surface so that your ankle can slide easily. Carpet, especially a thick carpet, would make it much more difficult. Another tip that the therapist gave me was to put a plastic bag over your foot so that it would slide easier on the surface that you've chosen. And this particular exercise is you extend your leg as far as you can, and then you slide it back as far as you can and hold it for 5 seconds. Then you release, let it go back out as straight as you can. Relax for about 5 seconds, pull it back again. Hold it for 5 seconds, as far as you can back. It's very painful at the beginning, but again, it's well worth it. I did this about 10 times each, and then at the end of 10 of the ankle slides, she had me wrap my good leg around my surgical ankle and pull even harder with that good leg to get it back as far as it could. That's usually at the point when I was using the other leg to pull back the ankle that she would take a measurement. The first day she measured my flexion at 70 degrees. After the 2 weeks of her coming 3 times a week, I was able to get my knee back to 117 degrees. That might not be the same for everybody. Again, I think it makes a big difference on the flexion that you had pre-surgery and the shape that you were in. The second ankle slide is done on your back, and I'm going to show you how that works. I use the aid of a rope from a bathrobe. Again, that was a suggestion from my therapist. You would lie down either on the bed or on the floor like I'm doing. And you're going to do an ankle slide. Again, hold it as far as you can. I would do 15 of these, and then the last 5, I would wrap the bathrobe rope around my bottom of my foot, and then when I pull back as far as I could without any aid, I would use the rope to pull as far as I could, and then hold it for 5 seconds. Release it, straighten it back out as far as I could, let it relax. Again, without the aid of the bathrobe rope, pull it back as far as I could, and then pull a little extra, a little harder, and get it back as far as you can. Hold it for 5 seconds. This was painful, but again, with the aid of the bathrobe rope, I was able to pull it back further than I could on my own, and it increased the flexion quite a bit. There's other exercises that you can learn, lots of different types of ankle slides. These 2 were the most beneficial for me. You can have a look at our website at mykneereplacementrecovery.com. Thanks for watching.